Good afternoon, everyone. Thank you so much for being here today. It's a little after 1 p.m., so we can get started. Welcome to Medicaid Administrative Claiming. This is a time study training for ADRC staff and supervisors. My name is Janice Ho, she, her pronouns, and I'm part of the Aging and Disability Resource Connection, or ADRC Bureau here at the California Department of Aging. Many of you are probably here today because you are a staff member, either from a AAA or ILC, and you were asked by your manager or supervisor to attend because you'll be participating in a time study next month. This training is to prepare you for the time study so you'll know what to expect and what to do when the time study begins. As some of you may know, CDA has been working with consultants from the Lewin Group over the last several months to help develop Medicaid Administrative Claiming for ADRCs, and they have been helping us revamp our time study process, including the activity codes and methodology, which we'll go over today. Throughout today's training, please feel free to type questions into the chat. We will also have time at the end for questions. So with that, I'll turn it over to our consultants from the Lewin Group to lead the training. Thanks.
Thanks, Janice. My name's Christina Bowen, and as Janice mentioned, I'm part of the consulting team from the Lewin Group assisting California with their Medicaid claiming. And so we've helped some other states with this, and we are also helping the Administration for Community Living as many states enhance and expand their no wrong door systems. So we're excited to be here today, and we're excited that you've made the decision to participate in this time study. It's certainly been a journey for those of you who have been with CDA for the last couple of years trying to look into this. But as we move through these slides, hopefully you'll see the benefit that it may have for you and your organization and the whole ADRC no wrong door system in California as a whole. All right, so just a bit of housekeeping up front. These are pretty standard, but this webinar is being recorded in case you want to come back and listen, or for people who weren't able to make it today. You're all muted during the presentation, but you can ask questions through the chat. Also, if you need closed captioning, you can click on that little button at the bottom of your Zoom screen. And if you have any technical issues during the call, we've provided the adrc@aging.ca.gov email address that you can reach out to if you need any help during the presentation. So what we're going to do today is we're going to go over what is MAC, or Medicaid Administrative Claiming. We're going to talk about the activity codes. Then we're going to give a couple of scenarios, and this is the interactive part of the training where we'll say a scenario and you will have a chance to respond via Zoom poll, which time study code you think it goes to, and then we'll discuss. And then we'll talk a little bit about how you're going to record your time. So if you participated in the first 2 time studies, you tracked 100% of your time. This is different because you'll be tracking time when you receive an email at a specific time during the day. So we're going to walk you through that and explain how that works. And then we'll take questions and get any of your feedback. Because as I mentioned before, we're sort of in a journey here, and that all of your participation and your feedback and input is really important for CDA as we move forward. So let's dive in. What is Medicaid Administrative Claiming, and why is it so important? So Medicaid Administrative Claiming really stretches state and local dollars because it is matched at 50% by the federal government. So this is beneficial because when you're going to ask your state legislature for money, you can say, we have this in place, so it will actually amplify any state dollars that you put towards this, or any local dollars if you're talking to local officials. The second reason that it's really beneficial to have this in place is that you're going to be reimbursed for activities you're probably already doing. You're probably already talking with people about what Medicaid is, what services Medicaid covers, whether or not a person wants to apply, and then you might even be helping them get their paperwork in order to make an application or making a referral for them to get their financial eligibility or to get an assessment. So you're probably already doing a lot of these activities, and it just makes sense to get reimbursed for them. The third reason is it's not a grant. So once Medicaid Administrative Claiming is in place with the ADRC network in California, you won't have to reapply. It's not like a grant that expires. It's just something that's in place and you can take advantage of it. And then finally, there's no limits on the reimbursement. So it does work like a reimbursement. So you kind of tell, in this case, CDA, and then they would tell Medicaid like how much of your time was Medicaid related and report the associated costs for that, and you get reimbursed. But there's no restrictions on what you can spend that money on. It's whatever would be beneficial for your organization. So those are some real strong benefits that we think make a lot of sense to take time and get this in place the right way and what will work for your state. Just to show you what other states have this in place, the states that are in blue on this map, 28 of them have some kind of Medicaid administrative claiming in place for their no wrong door ADRC system. So, and it varies. Some are getting a lot, some have a narrower scope, but most states get between 500,000 and 2 million per year. We do have some outlier states that are really involved in the Medicaid eligibility processes, and they're doing like the functional assessments and the financial, very involved in the financial part too, and they're getting a little bit more. But I would say most are in this range. And you can see the orange states are also planning for this. So there really aren't that many states that are not pursuing this. And we think that makes a lot of sense because, as I mentioned before, you're already doing these activities. So it really makes sense to get reimbursed for them. So here are some of the functions that are eligible for claiming. So anytime that you're doing education or outreach about the Medicaid program, anytime you're conducting an intake or assisting with a Medicaid application, when you're sitting down with someone in the context of person-centered counseling and talking about the pros and cons of applying for Medicaid as that fits within their personal circumstance. Medicaid may come up when you're assisting with care transitions from either the hospital or from a nursing facility back to the community. Also, when you're doing some short-term service coordination, you may be talking to someone about some of the services they need and if applying for Medicaid would make sense to get them some of those services. Another argument many states have been able to make through this process is that as you're working with people in the community, you're diverting them from more expensive institutional options, and that is actually beneficial to the Medicaid program. Continuous quality improvement is another activity that you are able to take advantage of for Medicaid claiming. And then finally, program planning and training. So any time that you're sitting down with your staff or staff from your ADRC networks and talking about Medicaid eligibility, Medicaid rules, what criteria for the different waiver programs, that is all claimable. So here's a little timeline of the journey that you all have been on. So some of you may have participated in that first time study in October of 2022. And so it looks like there were 4 ILCs and 2 area agencies on aging. And then the codes were revised based on your feedback, and another time study was conducted in February of 2024 with 90 staff participating from 16 organizations. And then we came on board in the spring, and some of the work that we've done is we had one-on-one calls with all of those organizations that participated in the 2024 February time study. We collected some of the lessons learned. We also talked with some other states who have been claiming, and learned from them what some of their best practices were. And then we had some calls with California offices that also do Medicaid administrative claiming. So the school-based system, so Medicaid claiming in schools, and then Medicaid claiming that happens at the county level. So those were some of the activities that we did, and all of those activities kind of contributed to this decision to test out a random moment time methodology. And we're excited to report that we have even more organizations in the second time study in this third time study. So we're really excited. The movement is growing to explore this for your network and get more funding. So we're going to talk about the activity codes, and I'm going to pass it to Kristen. But before I do, I just want to say like one overarching thing that you can think about when you're trying to decide what code is the activity I'm doing supporting the Medicaid program? And so what we've tried to do with these codes, we've really tried to simplify them based on feedback from the first two time studies. So in terms of like, as you're going through this training, try to think about like, what activities do I do on a daily basis? And where might they fit in these 8 categories? So I'll turn to Kristen, and we're kind of going to go through each one of these codes and definitions.
Thanks, Christina. Hi, everyone. I'm Kristen Vangeloff with Lewin. The next piece is a little dry. I just want to say that up front. So what we're going to do is actually take turns to go through 3 Lewin staff members here. We're each going to go through an example of the activities that fall under the code, and then explain what's Medicaid related versus not. And then the next Lewin person will take the next code. So hopefully by splitting it up, giving you some different voices, it'll make this just a little less dry. But I do want to acknowledge that we've got a lot of material to cover. So bear with us. And the next thing that we're going to get to, the scenarios, will be much more engaging. On this slide, I just, like I said, we're going to go through each and every one of these, but I just wanted to say up front that that referral coordination monitoring of services, the code 2, this is where options counseling, service coordination, transition services all fall. For those of you that participated last time, those were 3 separate codes, but we have collapsed them. So I think we can go ahead and just jump in, Christina, if you can go to the next slide. All right, so information and assistance. So some examples of what would fall under here is conducting initial intakes and assessments, providing information on various LTSS options available to the folks that you serve, providing warm transfers or other types of referrals to partner organizations and follow-up that goes along with those, and then performing clerical activities related to any of those prior bullets. And this would include filling out paperwork, making copies, or sending faxes, time that you would spend reviewing voicemails or emails, conducting research on any topics related to those prior bullets, consulting with a supervisor or coworkers, again, related to any of those first 4 bullets, and then travel, including time spent arranging transportation. All examples of information and assistance. Could we then go to the next slide? Okay, so this code has 2 subcodes, so 1A and 1B. 1A is information and assistance with Medi-Cal considered. So this would be providing information on the full range of Medi-Cal long-term services and support options and warm referrals between a wide array of organizations in your network that provide Medi-Cal services. And so then on the other side is the 1B, information assistance, where Medi-Cal is not considered. So providing information on the full range of LTS options and warm referrals between a wide array of organizations without discussing any information related to Medi-Cal or considering any referrals to Medi-Cal or Medi-Cal funded services as part of the interaction. So with that, I think I will turn it to Christina.
Yeah, thanks, Kristen. So you're getting a theme here. It's like, am I doing something related to Medicaid? Is Medicaid coming up in this conversation? So these are questions you can ask yourself when you're trying to decide what code. And so, information and assistance, it's probably occurring for most of you, I would imagine, on the phone. And so this next code, or it's a quick interaction potentially. This next code would refer to when you're spending a little more time with someone, right? So as Kristen mentioned, and it's in the blue box here, this code would capture options counseling. It would capture short-term service coordination and transition services. So those are 3 services that are spelled out in your ADRC agreement with CDA. But we want to be really clear that they would be recorded as this code. So referral, coordination, and monitoring. So this would be gathering any information that you might need to make a referral, completing interviews, assessments, to talk with somebody about their goals and preferences, talking about pros and cons of different options, providing assistance so someone can maintain in the community, coordination of services to like when you're doing care transitions, to go to a community-based setting, follow up to make sure that what you all talked about is in place, or does the person need any more assistance connecting? And then all of those clerical activities that have to do with paperwork and consulting with supervisor or coworker. And if you went to do this in person, your travel time. So that's what this code is about. And there are 2 subcodes here. Get to the next slide. 2A, Medi-Cal related, and the next one 2B. But for 2A, it's going to be activities that include making referrals, coordination, monitoring of services or other healthcare services when somebody already has Medicaid and you're helping them connect, or if you're helping them access Medicaid by assisting with their application process. And then 2B is not Medicaid, not Medi-Cal related. So these are the same types of activities, but you're connecting them with social services that are not Medicaid, educational services, legal services, housing, nutrition, food stamps, that kind of thing. So you're kind of thinking about, for this referral coordination and monitoring, you're thinking about what am I referring the person to? What am I helping connect the person to in terms of whether you're going to select 2A or 2B? All right, I'll pass it to Catherine to talk us through outreach.
Thank you, Christina. Hi, everyone. I'm Catherine Zontine, also with the Learning Group. Our 3rd activity code is outreach. Some examples of outreach include attending community events or health fairs, developing, marketing, or program educational materials such as brochures, disseminating or presenting program information to inform individuals, their family members, and partners such as providers, senior centers, etc., about services and where to obtain those services. And then finally, performing related clerical activities such as consulting with supervisor or traveling. And then the subcodes for outreach, 3A is Medi-Cal related. And so that would include activities that help inform people about programs that provide long-term services and supports, and other services that those also include a discussion of Medi-Cal or a service covered under Medi-Cal. And this includes both targeted outreach to specific individuals and broader outreach to the general population. And then code 3B is the non-Medi-Cal outreach code. And this includes activities that help inform people about programs that provide long-term services and supports, and other services in which only programs not funded by Medi-Cal or a service covered under Medi-Cal are discussed. For example, this would include presentations that only discuss non-Medi-Cal services or provide a general discussion of an issue, but do not discuss how that issue relates to Medi-Cal. And this also includes both targeted outreach to specific individuals and broader outreach to the general population.
All right, I think I'm taking it next. So you're halfway there. This is code 4 now. So we're making our way through. This is a pretty I say meaty. This one has a lot of details, so bear with me. So this is training and program administration, but on this slide, we're just talking training examples, and then we'll have another slide coming up with program administration examples. So examples of training activities that would go under here, participating in or coordinating training, which enhances the quality of intake, screening, options counseling, service delivery, or other components of the eligibility determination process. Participating in, presenting, or coordinating training designed to address the specific administrative and reporting requirements associated with program services. Attending training to maintain provider requirements to provide services. Attending training not related to the provision of service, but on improving the skills of the employee. So your first aid trainings, other HR required trainings that you might be doing. And then finally, performing related clerical activities, consulting with a supervisor, coworkers, and any related travel. So those are training examples. And if we go to the next slide, we'll have some program administration examples. So this would be staff meetings, generating reports and other information for quality improvement purposes, monitoring service providers as an agency. So not on the specific client level, but at an agency level. Collaboration via email or phone about processes, policies, and procedures related to long-term services and supports. Working with other partner agencies to improve coordination and delivery of services, expand access for population, and to improve collaboration. Collecting and entering data on program performance, and then finally, probably sensing a trend here, so performing related clerical activities, consulting with a supervisor or coworkers, and travel for any of the above bullets. All right, so 4A, so this is training and program administration related to Medi-Cal. So activities that provide staff with the required knowledge, skills, and abilities to assist individuals in accessing Medi-Cal long-term services and supports. This applies to coordinating, conducting, or participating in training and seminars. This one applies to training activities that address either Medi-Cal, a service covered under Medi-Cal, or a process that supports the Medi-Cal program, for example, intake, screening, access, and outreach. This would be time spent entering information about referral resources, such as providers into a database, or time spent documenting time for administrative claiming purposes would also go under this code. This would include activities related to establishing and maintaining documentation, internal processes and policies, as well as working with other partner agencies to improve coordination and delivery of Medi-Cal services, and performing collaborative activities with other agencies to actually provide services. Whew, a lot there on that slide. We did get a question in the chat. I wanted to call out about getting the slide deck. You will get the slide deck, and not only that, participating in the time study, we are developing a guidance document that will have all of this and more laid out in great detail. All right, with that, we can, so now we're on the non-Medi-Cal training and program administration code. So very similarly, activities that provide you with the required knowledge, skills, and abilities, but on the non-Medi-Cal related side. So applies to training activities that do not address a program, service, or related process that's related to Medi-Cal. So that very clear distinction. Medi-Cal related training would be 4A, non-Medi-Cal 4B. And then the last line there includes activities related to establishing and maintaining documentation, internal processes and policies, as well as that, coordination of delivery of non-Medi-Cal services. So, and other collaborative activities. All right, I think we can go to the next one, data and reporting. So that's back to Christina.
Okay, so this one's pretty specific. It's a little different than the other one. So data and reporting, we're talking about monthly expenditure reports, quarterly work plans, data reports, if you have to track service utilization, and then all the clerical activities that might come along with that, consulting with a supervisor or coworker, unlikely to be travel, but might be. So that's data and reporting. So again, the same designations for data and reporting. Is it Medi-Cal related? So this is the data that you're working with Medi-Cal. Is it going to be used for talking with other agencies about Medicaid or partner organizations? If you're, for example, like pulling together some information about like how long it takes someone from initial intake to eligibility, for example, and then you have a meeting about that, that is Medicaid related. So you would want to make sure you capture that. And then non-Medi-Cal, then any kind of data analyzation, reporting that you're doing that is not related to Medicaid. So maybe it's you're collating things for Older Americans Act or for a local food bank information. So that's what that would be. And then general administration is sort of a big category. I'm going to pass it back to Catherine to walk you through that one.
Thank you, Christina. Yes, Code 6 is general administration activities. So this would include paid time off, such as breaks, lunch, vacation, illness, holidays, or any other type of leave, as well as providing general supervision of staff and evaluation of employee performance that is not related to an activity. That could be included in another code. Also includes processing payroll, filling out, reviewing timesheets, human resources, and other personnel related documents, checking general emails and voicemails, attending general office trainings such as harassment prevention, information security, etc., and then finally attending general meetings. So some things to note about this code is that it should only be used if one of the other codes was not applicable. And again, this includes your paid time off. One thing to note is that time spent on administrative activities such as reviewing emails, voicemails, completing timesheets, making copies, etc., that were performed in support of an activity that is captured under another code should be classified under that code and not this one. And I'll pass it back to Kristen.
Great. So this is the code of last resort. You don't want to find yourself like using this code a ton. If you are, then maybe that's an indication that you should loop back with your coworkers or supervisors and make sure you got the codes right. Okay, Kristen.
Thanks for that, Christina. All right, one more slide. There we go. Okay, so activity code number 7. So at this point, you know, with the last one and the 7 and then the last one, number 8, we don't have those subcodes. So it's just straight up code number 7. So this is activities reimbursed directly by another source. Some examples here: providing transition coordination services reimbursed directly through the California Community Transitions Program, providing enhanced care management or community supports as a contracted provider through CalAIM. And then that last example, providing Medi-Cal funded transportation or interpreter services that are reimbursed on a fee-for-service basis. Go to the next slide. All right, so this code was pretty directly came about as a result of those one-on-one conversations that we had after the last time. If you recall, if you participated in the last time study, there was a Medi-Cal duplication code that caused, I think, quite a bit of confusion. So this, hopefully, this name of this code makes it a little clearer, is that any activity that's already reimbursed directly by something else would go here. So CalAIM came up a lot, you know, during our one-on-one calls. So activities that are directly reimbursed as through CalAIM would go here, you know, and then, you know, other programs. And this would be a good code as you're first starting out the time study to perhaps get together as an organization, you know, maybe with your finance folks, to figure out what are the activities that are going to come here. Like, what are the things that are directly, you know, fee for service reimbursed? What are, you know, CalAIM, you know, other programs. So time, let's see, and I wanted to call out time spent on Medi-Cal waiver programs fall under this code. And so we've listed the Medi-Cal waiver programs here on the slide, and they'll be in the guidance document as well. So I won't read through all of those.
Yeah, I want to just add too, Kristen, so it wouldn't be time spent helping someone get on a Medi-Cal waiver, because that would be claimable. But it would be like if you were a case manager for the waiver and you were helping coordinate someone's services, you're already getting paid by Medicaid for that. But what you're not getting paid for now is helping the person become part of that program. So I think that's an important distinction.
Yeah, thanks, Christy. I know that came up during, I don't know if it was a work group call or maybe it was a roundtable. Talked a little bit about CalAIM and what CalAIM actually directly reimburses for versus the activities that get up to that point, which could still be claimable under MAC. So a lot of nuance. And so we'll hopefully do a good job in the guidance document, providing those examples so that it will hopefully be clear this go around. All right, we can go to the very last code now, other, and I believe I am taking this one as well. So Christina mentioned that the general administration code is a last resort. So this is a really, really last resort. If your activity didn't fall under any of those other activity codes, it wasn't under general administration, you would put it here. And in this survey, there will be an option to explain, in a short description what that was. So this other activity code will capture those things that you just really are not sure where else they would go. And we'll ask for a description of the activity so that CDA or supervisors can go back and actually look at that code and make a decision that, well, maybe it does actually fall under another code and it could be recoded, or maybe it'll help us understand that there's an additional activity code that's needed. So that brings us then to the end of the activity code description. So congratulations, you made it. I know that was a little dry. But now I'm going to turn it to Christina and we'll go through some scenarios. They'll be much more interactive.
No, that's good. That's good. And this other code is also, I mentioned this is a journey. So this is a journey for your state. And this other code, if you're entering in, what you're doing that doesn't fit in the other codes, it's also going to help CDA with ongoing training, right? So one of the lessons learned from other states is that the more training that they provide for the local staff doing this time reporting, the more accurate the time reporting ends up being. And then the more funds come back to you at the local level, because you're, like we said, you're doing this work, just not getting paid for it right now. So you want to be able to represent how much of this work you're really doing. And this other code will help you tweak and refine as you move along on this journey. All right, so let's get into a few scenarios and we can test everyone's knowledge here and see. All right, so you're gonna see a little poll pop up on your screen, but this is you're at a senior expo, you're working the ADRC table, you're handing out brochures, and you're explaining Older Americans Act services like maybe Meals on Wheels or caregiver support, respite or something. How would you code that? So these are your options. Is that information and assistance? Is that referral coordination and monitoring? Is that outreach? All right, training, is that data? All right, so I'm seeing a decent number of respondents coming in here. If you end the poll, Janice, then we can see it and we can kind of look and see what I see some people are saying information assistance, some people are saying outreach. Those seem to be the two biggest ones. The answer is outreach, non-Medi-Cal. So that is the answer for this one, and I think if I click through, it's going to appear on your screen that the answer is outreach, non-Medi-Cal. So I can see how some people might think information and assistance, but I think what you want to think about here is what tipped me off was you're at a fair or an expo, right? So, sometimes there is a blurry line between information assistance and outreach, because you could be having a one-on-one conversation with someone who came up to your booth, and you could really start getting into it, like what are their needs and all of that. But for this example, we're going to say that anything you're doing at health fairs or expos, or if you were asked to give a presentation at a senior center or at a senior housing facility, that's that type of question. So I do see some hands up, Janice. Do we want to just have people type in the chat if they have a question about this? And I'm thinking this might have raised some questions. We can take them as we go along, or we can wait till the end. It's your preference.
I think we can take them as we go along, Christina. That would be great.
Okay.
Your hand, Betsy.
Thank you. So I'm just thinking about the way that our information and assistance does outreach. So I did identify this correctly because you were really clear in your instructions that OAA would be separate. And typically I'm thinking about like the actual world when we're representing ADRC at, say, the Senior Expo, in that there's a ton of crossover because we're linking clients to Medi-Cal related programs such as IHSS. We're discussing things like that. We're discussing resources under the Older Americans Act. There's kind of some crossover there. So how would we code that type of time?
Yeah, so I think we have another example that's, I think later on in the scenario, where it says like, if you talked about Medicaid at all at that outreach event, then it would be Medi-Cal considered, or Medi-Cal outreach. It's just that in this example, I was like narrowing it down to those Older Americans Act programs that are not Medi-Cal, but yeah, I think that's a great example. I'm glad you brought it up, because in the real world, you're probably not just narrow focused on just one program, and you're talking about all of the options. So that
beyond that, like Medi-Cal related programs. So IHSS, right? You have to be on Medi-Cal. So you're having a Medi-Cal discussion, but only as it relates to eligibility for IHSS, right? So
yes,
yeah.
yes.
Thank you.
Yeah, that's a great question. Thanks for raising it. All right. I think we can move on to the next one. Okay. So you consult with your supervisor on eligibility requirements for Medi-Cal. We can launch the poll. So you're consulting. So is it information and assistance? Is it referral coordination and monitoring? Is it outreach? Is it training? All right, so a lot of people are saying it's training. Oops. Yeah. Yes, and that is correct. You're learning about Medicaid, and what are the income requirements, what are the eligibility requirements, and I would say this too, like any kind of, if you're onboarding new staff, this is a code that you're probably going to use quite a bit, right? Because you're making sure that person understands what Medicaid is and what the requirements are, so you can have conversations with people. All right, scenario 3. You and your colleagues are in a meeting, so between the AAA and the ILC in your ADRC partnership, and you're trying to coordinate and strategize about the delivery of nutrition services in your area. So what would that be? Let's launch the poll and see what people think. Yeah, so I'm seeing some referral coordination and monitoring and some training program administration. So I do think it is going to be training and program administration, but it's going to be non-Medi-Cal, because if you were talking with them about eligibility requirements or some problems that you've noticed that a lot of people are facing when they're putting their applications in, or how long it's taking for people to hear back, then that would be training and program administration, Medi-Cal related. Awesome. Thank you. Am I messing up the poll, Janice, in any way by clicking out of it?
Not at all. But maybe we can wait until it reaches 50%, Christina, so folks have some time to respond.
Okay.
Yeah, thanks.
Sounds good. All right. You're helping someone apply for in-home supportive services. So this was the program that was just mentioned, including determining proof of residency, Medi-Cal eligibility, and completing a healthcare certification form. All right, so let's launch the poll and see what people think. Yeah, people are pretty, all right, I'm not going to say anything until you end the poll. But I see everyone coming in with Medi-Cal considered, and that is right. It's just a matter of choosing between whether it's information assistance or referral coordination and monitoring. All right. So it is referral coordination and monitoring of services. So I think it can be tricky to kind of figure out, like, is it an information assistance, or am I like spending more time with them and really like digging in and helping with the referrals and really talking to them about like what decisions they want to make. So I think that can be tricky, but for this one, I would assume that you're spending a decent amount of time with the person. And yes, I see Maggie has a question.
Yes, thank you. I have a question about scenario 3 that was considered non-Medi-Cal. And what if, and I know this is not talking to the client, this is strategizing, but what if the conversation is, well, do they have CalFresh yet? And hey, what about are they on Medi-Cal? Are they eligible for Medi-Cal? Because sometimes people, once they get on Medi-Cal, they might have more money for food. So couldn't you, if you go in that direction and talk about Medi-Cal and strategize whether they, so I guess that was my question on that one.
Yeah, no, Maggie, that is an awesome question. And I would say yes. So, and I think a general rule of thumb is to say, like, in the activity, is what I'm doing Medicaid related? So if you're saying like, well, we're sitting down and we're trying to crack this problem of the delivery of nutrition services, and it comes up that the person, maybe if they were on Medicaid, they would have a greater opportunity. Like if Medicaid comes up in the conversation, I would say yes. But anyone disagree with me? Okay, I think that's kind of like the litmus test you have to ask yourself. So I like that. You took this scenario and you like took it to the next level. Like, well, what if we talked about this? So I think that's right, Maggie. And that's exactly the kind of thinking that we want everyone who's doing the time study to have, and to provide feedback so that as you keep moving through this, your training is going to get even more specific to your daily tasks and what you're doing, and it's going to become more accurate over time.
And I would just say that this isn't just about saying, do we talk about Medi-Cal or don't we? It also reminds us that there may be opportunities we're missing to talk about Medi-Cal, and to expand that, even if we may not be the Medi-Cal expert, but we can be finding out if it would help people. So I like that. I mean, that's really the goal, is to get more people really on Medi-Cal if they're eligible. So thanks.
Yeah, thank you, Maggie. And I'm seeing this question from Kat about scenario 4 too, saying scenario 4 seems more like INA because INA does the processing of IHSS. Okay, so, oh, and then I see your second comment, Kat, so I might have described it, but I think It can be difficult to distinguish between those two codes but the way I think about it, and I think you guys will help us refine this as we go along, is if you're, thinking about helping them apply, not actually processing. So yeah, like if you are spending, like in the referral coordination and monitoring, like time sitting down with that person and talking through eligibility, maybe you have the paperwork in front of you, maybe you're kind of like helping them fill out the different applications. I would say that's a little more than information and assistance. Like maybe an information and assistance, like maybe that person didn't need help with those pieces. Does that make sense, Kat? Am I interpreting your chat correctly? Okay. It sounds like, okay. All right. So we can go on to 5. Okay, this should be an easy one, I hope. Okay, you're providing case management for a person through CalAIM. All right, let's see what everybody thinks. Is it information and assistance? Is it referral coordination and monitoring? Or is it activities reimbursed by another source? So, all right, good job, everyone. That was an easy one, I think. So, all right, it's good to have a couple easy ones. All right. You return to the office after attending an outreach event where you discuss Medi-Cal and non-Medi-Cal services. This kind of speaks to the question we were discussing earlier. So what is this? All right. Wow, I think we have everybody really paying close attention here. So this is great. Couple more seconds. Okay. Oops. What happened to my my answer on that one? Are you guys seeing the answer?
Yeah, I think the
Okay.
answer came up a little early.
Oh, okay. All right. That is outreach Medi-Cal. So that speaks to the scenario where, you know, in the real world, you're really talking about a bunch of different options when you're asked to give a presentation or do an outreach event. Great. Okay, so this one's a little bit longer, and I think when we did the call with the ADRC activity code work group, they said, could you walk us through like a scenario, like all this, you know, kind of like a scenario you might encounter. So this is one where you're talking to someone about assisted living options. And so when they call, you're talking about like why they want to move to assisted, why they think they want to move to assisted living. You're talking about different facilities in the area. You're also talking about home-based care options, payment, and the difference between Medicare and Medicaid comes up because, as we know, there's a lot of confusion out there about that. And then the caller said, thanks for the information. She would think about the options, and no referrals were necessary. So what do you guys think about that one? Let's launch the poll. Give it a few minutes here. I think we just have like one more scenario, and then we're going to move on to this random moment time study, which will be new information and fun. So great. I'm seeing the results of the poll here come in. A lot of people voting. This is great.
Just double checking, Christine. I think we have 10 scenarios, right?
Do we have 10? Okay. Sorry.
Okay, just double checking. Thanks.
All right. Someone cut me off if I'm going too long, but we got a couple more for you. All right. We can probably end the poll. So yeah, most people voted the correct way for this information and assistance Medi-Cal considered. So yeah, some voted for referral coordination and monitoring, but in this case, I would say it's information assistance because it was a phone call, no referrals were needed, but definitely Medi-Cal came up and it was considered as one of the options you were discussing with these folks. So, all right, scenario 8. A provider called to ask about non-medical transportation options for a client, and you collected the necessary intake information, recorded the call topics, and compiled and emailed transportation information to the provider. So what do you all think for this one? Let's go ahead and launch the poll. Also, you can give us feedback. Oh, I see a couple chats here. Do we need to respond to these chats?
No.
Okay. All right. Okay, we can, and the answer is the big reveal. You sharing the results? Okay. This one is information assistance Medi-Cal not considered. So again, it's like a short interaction. You're collecting some information, but Medicaid is not coming up. All right. Scenario 9, you receive a call from an individual who tells you they have insurance through Medi-Cal. They want information on where to receive a flu shot, and you direct them to a pharmacy that takes Medi-Cal. So let's see what this one might be. Great. Oh, you guys are getting too good at this. So great. I'm seeing people coming in strong with this one, which is information and assistance Medi-Cal considered. All right. And this is now our final scenario, Janice. We're at 10 now. So, okay, so this one gets really confusing. So I'm hoping we can spend a little time on this one. So the specified low-income Medicare beneficiary says SLIMB, and this also would apply to Quimby. So look, all the Medicare savings programs, even though they have Medicare in the name, they are considered Medicaid programs for this, because they're basically like, I would be paying for my Medicare premiums. They're helping to pay for your Medicare premiums, but the state is like picking it up. So it's Medicaid. Hope that's clear. But anyway, so if you're talking to someone about those Medicaid savings programs, is that Medicaid related or not? So go ahead and put your answers in, what you think it is. Oops. All right, let's see our results. All right. So this one is referral coordination monitoring, and it is Medicaid related, Medi-Cal related. So, and I think some of you answered information assistance, and I think this one would be like you're a little more intensely working with the person because you're helping them fill it out. So that's why I would go with referral coordination and monitoring. So anyway, congratulations. You got to the end of the scenarios, and keep the questions coming. This is good. I see a lot of activity and engagement in the chat. So appreciate that. And I'm going to turn it to Kristen. Right? Are we going to go right into the random moment? Okay. I'm looking at the time, so I think we should.
Yeah, we can do that. And we'll, happy to take questions at any point. So can keep on moving on through the slides. One more. All right. So I'm going to go over just how this time study is going to work, how it's going to be set up. It is different than the 100% time tracking where you had those Excel spreadsheets last time. So as the title says, it's a random moment time survey or time study. It's going to happen from August 15th through September 15th. So we're going to get 1 month of data. Surveys will be sent to the email address that you send to Janice, and you will get them at random moments throughout the day. The number of surveys that we need to complete is based on the number of people participating. We use a sample size calculation with confidence intervals and margin of error specified by CMS to determine just how many surveys we need in order to get an adequate sample size. So you can see just for this 1 month, of the study. If we get up to 70 folks or more participating, we'll only have to do 2 time studies per day. If we get up to, I think, like 150, 180 or like that, it would go down to one per day. So right now, I think we're just aiming to get over the 70 participants so that you'll only have 2 short surveys to complete each workday. As I mentioned, the survey responses are what we're going to use to calculate the percentage of time, spent on each of these activity codes, and therefore, how much of the time is claimable. And then that will go into the cost pool calculation for your organization. I see a question in the chat related to the random moment time study, so I'm going to take that one first. Betsy Harper says participants total or per organization, and thankfully it is total. So not per organization, it's total across everyone participating in the state. I think I'm going to keep going through these slides, and then we can come back and talk a bit more about Quimby and Slimbly if needed at the end. Is that okay, Christina? Janice? Okay. All right, we'll keep going through here. In terms of which staff should participate, I mean, anyone's welcome, but we'd encourage folks that have direct contact with consumers, and especially, excuse me, those staff that would be doing a lot of the Medi-Cal related activities. Go to the next slide. All right, so the process. You will receive an email from adrc@aging.ca.gov with a Microsoft Forms survey link. And again, that will come to the email address that you provide Janice. You'll need to click on the link within that email and complete the survey within 2 business days of receiving it. So if you receive it on a Friday afternoon, you'll have until Tuesday afternoon to complete it. Each survey link is going to be unique to that particular moment. So you need to use the link in that email each time. You can't go back to a prior email or bookmark the link to use it each time. It is going to be a different link each time that there's a random moment survey sent to you. We also ask that you not forward the surveys to others. If for some reason you can't find the email that you saw come in, that would be a time to contact Janice or the ADRC email address. So number 3 now, answer the survey questions about the activity you're doing at the time the email was received in your inbox. So probably most of you all use Outlook or some other email program similar if it's Gmail, but it'll all have a timestamp, and the screenshot here shows if you were seeing the full view of your email, it would be the upper right-hand part of your screen. So at that time, and for some of this, you'll have to use your best judgment, especially if you were out of the office at an outreach event or, in a meeting with another organization at their office. But to the best of your ability, your best judgment, what were you doing at the time that email came into your inbox? You can go to the next slide. All right. So what's on the screen now is a screenshot from a draft of the time study Microsoft Forms survey. The actual one is going to be housed at CDA, so it may end up looking just a little bit different. This is a kind of a test version that Lewin put together. But questions should be pretty much the same format, similar. So first thing we ask is that you enter your email address. Please make sure that it's spelled correctly and it's the one that you sent to Janice. This is kind of going to be the unique identifier that we use on the back end. And then you'll select your organization name from the drop-down menu. If you're participating in the time study, then your organization name will be on the list. And then we get to the first question that requires a little bit of thinking. So question 3 is this random moment within your normal working hours, even if you were on leave, or during a time you were working outside of your normal working hours? And when I first came across this question, I had to read it a couple of times to really understand what it was asking. And so I think the simplest way to go to do this is to go through some examples, and that's the ABC bullets on the slide. So let's say the email arrives at 4:28 p.m. on a Tuesday. You are scheduled to work 8 a.m. to 4 p.m. and you're not working at the time that the email arrives. So you would select no and submit the survey. You're done. Now let's say the email arrives at 4:10 p.m. on Wednesday. You're scheduled to work 8 to 4 p.m., but you're still working with the client and have not yet signed off for the day. So in that situation, even though you are not scheduled to be working past 4, since you in actuality were, you would select yes and then continue with the rest of the survey. All right, and then the last example here, the email arrives at 10:34 a.m. on Friday. You are out sick and open the survey when you return on Monday. You would select yes, because it was a time you were scheduled to work, even though you were on sick leave or paid time off, whatever term you use. You would select yes and continue with the survey. And in this case, since you were out sick, you would select the general administration activity. All right, taking a quick look at the chat, I see a question from Carly. Would it be possible to receive a copy of what the survey looks like, including the different logic-based response options, maybe a dummy survey that isn't actually collecting responses? So I know we're going to have screen captures in the guidance document, but Janice, I think this is certainly something we can, talk through, and I think that could be very helpful to have that kind of dummy survey to play around with, to understand how it kind of moves through the question. All right, let's go to the question from Maggie. Please go ahead.
Yeah, I just have a question, and you may have changed it, but I know so we're all going to be filling out the actual survey form that you give us. And then when we get the email about this survey, then we're going to look at that other survey form and go and see what we were doing at that time. We're still doing that, right? I just want to make sure, because this is different than, the last time they did this. So I'm glad, but I just want to clarify, since I heard that last training.
It's very different. There's no Excel spreadsheet. There is nothing to fill out except for these, assuming we have enough participants, these 2 surveys per day.
Oh my God. So we just basically go about our business, and when you send us that, we tell you what we were doing when you sent it.
That's correct.
Oh my God. Okay. Thank you.
Yeah, we've heard really good things from other states that use the random moment methodology. That it is less burdensome kind of once you get the hang of it. There are pros and cons, of course, but that's why we're kind of doing this trial run. So, but no other documentation, just this web survey at the random moments that you receive it every work day. So it'll be just Monday through Friday. I think is the plan. Katie had a comment in the chat, every day for the month. So it'll be every work day. And I know that there is a Labor Day there, so we may not program the survey for that day, but or I guess maybe we'll figure out exactly what to do about the holiday. That would go under the general administration, but every work day for them.
And has the potential to be a lot more accurate than 100%, because you don't have to remember at the end of the day all the different things that you did, but you just have to remember or just record in real time what you're doing for that one time stamp.
Mm-hmm. All right, a question from Kat in the chat. The employees on my team and I were all forced to use our personal email addresses when we registered for this training, as it wasn't accepting our work email addresses. How do we change the email address so we receive these at our work emails? So I think that's about the Zoom registration. There was something a little wonky with having to have a Zoom profile. So for the surveys, for the time study, you would email Janice and let her know the list of work emails and the people associated with them that will be participating. So we won't be taking the emails off of the registration from this Zoom. And let me know, Kat, if that did not answer your question. All right, so then going back in, we just covered the questions 1 through 3. So if you had said it was not within your work hours, you would have gone to the end of the survey and submitted, all done. But assuming the survey comes when you are working, you would then go to a question where you would select the activity code that best reflects what you were doing at the time you received the random moment email. Again, checking that timestamp just to be sure you know when that email came in. And as we, went through on the, during the activity codes run through, if you don't think that what you are doing falls within any of those first 7 options, then you would select other. And then if you did that, another question would appear with an open text field where you can describe the activity that you are doing. And then your supervisor or CDA can take a look at that and figure out, is there another code it could fall under? Do we need a new activity code? And as Christina mentioned, just, it'll help us learn for the future. You'll note there, we say, do not include any protected health information. This isn't, anywhere where you want to put probably any PII or definitely PHI, but that'll all be in the guidance document as well. All right, so if you hit other, you'll put in your description and that'll be the end of the survey. But let's say that one of the other activity codes did apply, you would select whichever one, and then the branching logic would take you to the next question. So in the last, let's say in question 4, you selected information assistance. What would come up next then is, was Medi-Cal considered? And then you would have the description there to select either yes, Medi-Cal was considered, or no, Medi-Cal was not considered. And then a request to briefly describe the activity you are performing, again, not including any protected health information. And so this is, you want to provide enough information that, your supervisor CDA could take a look at it and be able to do some quality assurance checking just to make sure that it's aligning with how we are interpreting the codes. But we're not looking for a novel. And then you would submit the survey, and that would be it for that random moment. Okay, let's see some other questions coming in. Okay, that was it in terms of what I wanted to cover on the process of it. As I mentioned, we do have a guidance document we're developing, which we'll share with everyone who's going to take part in this time study. At this point, Christina, did you want to go back to anything on the Quimby or Slimby question from Mary? I wanted to make sure that was answered.
I think I tried to answer it, but maybe I didn't see it. Let me see. Mary, yeah. So if you just gave them the application, I would say it was Medi-Cal considered, but maybe just INA. Hope that helps. Okay. Yeah.
Okay, and it looks like you did get a thumbs up. Great.
Okay.
Janice, is there anything we're missing in the chat? I just want to make sure that we're not.
No, I think we covered everything. So yeah, right now it's a free question session. So if you have any questions or comments, please feel free to unmute or type your questions in the chat and we can respond to them at this time.
Or raise your hand so we can see you have a question. Either way. Yeah, so Carly is asking about how diversion factors into these activity codes. Janice, do you want me to take that and talk through some of our discussions, or do you want to take that one?
Yeah, you can start, Christina.
So we have modeled these codes after other states that have that at risk for institutionalization designation in part of their referral coordination and monitoring code. So let me go back to the codes so that this makes sense. But we don't have like the information yet from California Medicaid on what that might look like specific to your state. But I think it's something that CDA wants to consider in future time studies. So some states have instead of just having Medi-Cal related and not Medi-Cal related, they do have for this code, like another code that speaks to at risk for institutional placement, which would mean like in a certain number of days, were they to go into an institution, they would become eligible for Medicaid. So anything that you want to add to that, Janice or Kristen?
I guess just in terms of the logistics of adding in a code that would capture diversion activities. So you have to have a methodology for documenting that a person both is at risk of spend down to financial eligibility for Medi-Cal, and as well as having a nursing facility level of care. So they actually have the functional needs and the financial. And so it requires just an extra piece of documentation to go along with it. But states have had a lot of, well, you guys do a lot of that activity, and it does support the efficient and effective run of the Medicaid program. So it's definitely claimable. There's just an extra layer of documentation that's needed in order to count that time. And what other states have done is, and Christine, I apologize if you already said this, but so like referral coordination and monitoring of services, you would have the code 2A, Medi-Cal related, 2B, not Medi-Cal, and then a 2C, which is, at risk of spend down to and institutionalization. So maybe coming in the future.
Yeah, but for the purposes of this time study, and this could be a case-by-case issue too, if you're having some questions, you can reach out to me and we can talk through it. In the meantime, I think we can put that under the code 2A for referral coordination monitoring of services Medi-Cal related as you're doing the time study.
It's a really good question. Thank you for that one. Yeah, so Mary has a question. Is anything CalAIM related going to fall under activities reimbursed by another source? Yes, so if you're getting reimbursed by CalAIM for case management, you would not select referral coordination and monitoring. You would select activities reimbursed directly by another source. So yes.
But if you're helping someone with an application or how that works, if you're helping someone to get to CalAIM, that then could be claimable as either information assistance or referral coordination and monitoring, depending on the depth of involvement.
Yep. Carly, another question. Trainings that improve service quality to Medi-Cal and non-Medi-Cal participants. For example, motivational interviewing. If the training doesn't address Medi-Cal but improves services for Medi-Cal related activities, will we select Medi-Cal related or okay, oh my gosh, that's such a good question. So a motivational interviewing, it would be like perfecting your skill as an interviewer or assessor or someone to have those types of conversations. I would love to say yes, but I'm trying to make the Medicaid connection in my head. Do you want to come off mute, Carly, and say a little more?
Yeah, I would say about, I think you're exactly right. I'm just thinking about trainings that improve our service delivery and ability to work effectively with people are going to benefit Medi-Cal activities and non-Medi-Cal activities. So just wondering if that would count or not, I guess.
That's such a good question. I think you've stumped me.
So it would probably have to be non-Medi-Cal unless we could really make a direct, I don't know. It would be nice to make that connection, but that might have to be a question we take up to ACL or CMS.
I guess it's like, if the person was like reluctant to apply for Medicaid, but through motivational interviewing, you were able to sort of like get at the benefits of it or something. Yeah, I could see it's a very nuanced one though. I guess you get an A+ for like a very complicated question. But these are the types of things that we do want to kind of log and keep track of. So we will definitely log that. Carly, thank you for the question.
And maybe what I'm hearing is if it's really, we're not sure, then go with non-Medi-Cal and, we can ask the questions as they come up, but it sounds like we would maybe default to non-Medi-Cal just for.
Yeah, I would say ask the question during this time study, because I think the more questions that you ask of CDA, the better, like, we're going to have a repository to build on for future. So I would say ask if you can. I hope that's okay, Janice. I'm speaking for you. You're probably going to be the one they ask.
Okay, Janice, will consider yourself asked.
Okay. I'm looking to see if there's other ones here.
Mary
Yes.
had a follow-up on the CalAIM question. So say the referral hasn't been submitted, but the work leading up to that, I would say that would be Medi-Cal related.
Mm-hmm. Yeah.
And then related there, if we are not getting reimbursement for monitored coordination with assistance with CalAIM services, would that still go under reimbursed by another source?
So I would say no, Delia, but do you want to explain what that situation would be? Like, you're helping someone who's on CalAIM, but you're not like their case manager, or?
Can you hear me?
Go ahead.
Yes.
Yeah. So what it is that we are assisting consumers, members that are going to receive services under CalAIM, but we are not being reimbursed for the coordination time that we spend making sure that or coordinating for the CalAIM, for example, home modification services. We are not being reimbursed for the coordination time. We only being reimbursed for the amount of money that CalAIM allow for home modifications.
I see. So for the actual like home modifications, whatever it is, a ramp or grab bars or whatever, you're getting money for that, but not for like making calls to book that or whatever.
Yeah.
Or helping them connect to other services.
No, nothing.
So I mean, I don't know if Janice, you have thoughts, but I would say that if you're not like officially getting reimbursed to do case management or something, then you're not being reimbursed by another source, but you are helping someone on Medicaid connect to services. So that seems like that would be.
Not connect, actually doing the work, making so the coordination of the home modification, it's under us. We are doing that, calling the consumer, making sure that they are, medical eligible, doing the intake, do the whole coordination. Not connecting them, not referring them for somebody to do it. We do the program. We have the program.
And you're not getting reimbursed through CalAIM
No, we're
for
not.
that time?
Not for the coordination, no. Just for what the contractor charge for the home modification services that they're going to do, which may be different from a grab bar to a bathroom modification.
So that sounds to me like you're not getting reimbursed for that referral and monitoring coordination, but.
So I think that coordination piece would be claimable through a Medicaid Administrative Claiming.
I'm sorry, say that again, you were cutting off.
The coordination piece of that, I think, would be claimable through Medicaid Administrative Claiming.
Thank you.
Thanks
So that
for,
would go under 2A.
Thanks for the question, Delia. So there's a question from Betsy about data reporting. And this might be a CDA question. So the data reporting that's done for the ADRC as a whole, which includes Medicaid related programs or referrals, does that count as Medicaid related? So I would say yes, but Janice, I'm not exactly sure what is in the data report that they're turning in. So maybe you could speak to that.
Amanda, maybe you could speak to this. Do you know what Medicaid data we're collecting?
Yeah, I think a fair amount of it really is related. It's just, you know, in the different sections of the report throughout. So I think that that would be.
Okay, that's helpful. These are all great questions. Any other questions? Well, thanks for sticking with us so long here. Appreciate that. All right, Janice, maybe we'll hand it back to you to close us out.
Yeah, thank you again so much for attending the training today, everyone. So we will be sharing this recording along with the slide deck out to everyone. If you are interested in participating in our time study, it will be running from August 15th through September 15th. So if you're interested, please send me an email. And when we send out this recording, I'll also include my information in there so you can all let us know. But thank you again so much for your time, and we look forward to your participation. Have a great day, everyone. Bye.
Bye.